The global community has set a target to end AIDS by 2030. And we are doing this following the UN AIDS 95-95-95 targets, meaning that 95% of the people should know their HIV status, 95 should be on antiretroviral drugs, and 95% should be virally suppressed. For us to ensure that HIV is no longer a public health disease that we should reflect on all the time. Usually in the cities, the prevalence of HIV is high because it brings together people from all walks of life, and it is an area where infection is fueled through so many causes, and Lira City is not exempt from this. The reason why we engage cultural leaders is because they are elders in the community. People listen to them, and as custodians of culture, they need to speak to the people to restore the initial good cultures that we had, which was built on abstinence and being faithful. These days, HIV is being spread majorly among the young people. They need to reach out to the young people to understand that AIDS still kills. And not only does it kill, but it breaks the development of any economy. It is actually one of the issues that has taken the economy of Uganda backwards, because we spend a lot to keep people alive, and yet all these resources could be channeled to doing better work to build our economy. So we need to put an end to the spread of infection or new infections, and ensure that those who are already on drugs are virally suppressed, so that we don't continue the spread of infection. Today, we have had opportunity to engage cultural leaders and reaffirm their positions to them, their roles to them, and the need for them to speak to the people. And I am very happy that they have committed to ensure that the high prevalence of HIV in Lango goes down. They have committed to unity as a source of our strength to ensure that we build and develop Lango as a people. So I want to extend special appreciation to them.
Thank you very much. My name is Tom Eti. I work with Uganda Aids Commission as the Acting Director Partnership. Uganda Aids Commission, we coordinate the HIV response in the entire country towards implementing the Presidential Fast Track Initiative of Ending AIDS by 2030. So within this framework of Ending AIDS by 2030, and also the mandate of Uganda Aids Commission of coordinating all the stakeholders who work with the cultural institutions, we have 18 cultural institutions across the entire country and other kingdoms and institutions that have been brought on board. So right now we're engaging all the cultural institutions in the country. Today we are engaging Lango cultural institutions. We realize that the cultural leaders are the gatekeepers of all the social issues within the communities. They are in charge families, they are in charge social support, they are in charge all the system that operates within actually our society. So when it comes to the HIV and AIDS issues in this country, they are the major stakeholders that can create awareness among the community. They can actually create support to people who have already, living with actually HIV. And within the Cultural Institute of Lango, we have 174 clans that covers the entire Lango Sub region, which is about a population of about 3 million people. So this is actually very critical at this moment, that they will reach each and every household in the family meetings, in the clan meetings, in the church, at the burial, in the wedding ceremonies. So cultural institutions are actually very critical.
Now regarding this campaign against HIV, I think it is very paramount that we as cultural leaders, we actively participate. Reasoning being, everybody born is born from a family. The family constitute society, and it ends up being a cultural institution. That means the backbone of any child, of any person, is based on the culture. We are the very people who can go deep into the villages to talk about this HIV. As you know, we have a route up to the village level. The cultural institution has a network up to the village level. And if you may know, you might find that a lot of HIV prevalences is much more, even in the villages. And who can reach there? It is we, the cultural leaders, who can reach there. Because those are our people. We always interact with them. When there are burials, we go there. We go and talk to them. So it is only we who can infiltrate up the villages. Most of these activities here in town are done by town people, but the cultural institution will go deep into the villages, into the roots of society. So I think it is very important that we are being included into this, and as you know, we are always with our people. Like today I was supposed to be in Ibuje, tomorrow I'm supposed to be in, tomorrow but one I'm supposed to be in Utuke. We are the people who can reach our people. So I think it is very good that we have been made a part and parcel. We have been given the knowledge. We have been given the causes of the HIV. We have been also given the knowledge how it can be what? Prevented. So it is up to us now to take that role, and then we go and dispatch knowledge to the society so that HIV can be controlled.